Expecting Health. And I'll be hosting and moderating this webinar. So this is our last session for our Newborn Screening Awareness Month Education and Engagement Series, and we'll be talking about getting the narrative storytelling through surveying. So thank you all for joining us, and we will get started. A few logistics before we delve deeper into the presentations. This webinar is being recorded and the link will be made available online on Expecting Health's YouTube channel. If you have any questions, please feel free to type the questions in the chat box and they'll be addressed at the end of the session. Also, if you have any IT or technical assistance, please feel free to message Brianne Miller and she'll be happy to assist you. And the agenda for today, we have two wonderful presentations. The first is by Baby's First Test Director, Natasha Bonhomme, and she'll be talking about our newborn screening family education program, a data-driven approach to education. And after Natasha, we will have Allison Wood, a genetic counselor and a parent with a child with a newborn screening condition, who'll be sharing findings from her study about family reflections on receiving out-of-range newborn screening results. And once the presentations are done, we will have a Q&A session. And we would just like to thank Applied Therapeutics for supporting this education and engagement series. So this session is part of a three-part series where we've had two previous education and engagement sessions about gathering family feedback through various methods, and they will all be uploaded to our YouTube channel for you all to watch later. And while Newborn Screening Awareness Month is ending, I think raising awareness and learning more about newborn screening never stops. So we are co-hosting the 2020 Newborn Screening Boot Camp with Everlife Foundation, and this is part of a 5-part training series that will begin on September 30th and run through October 28th. So we would love for you all to register, join, and learn more about newborn screening. And you can find that information at mbsbootcamp.org. And without further ado, I will go ahead and provide brief introductions to our wonderful speakers. Natasha Bonhomme brings nearly 15 years of nonprofit and maternal and child health experience to Expecting Health. And she launched Expecting Health to bring a range of consumer and professional stakeholders together to address the need for clear, science-based information for families and individuals through tangible and actionable messages. We also have Allison Wood, who is a genetic counselor specializing in cancer and prenatal genetic counseling at Albany Medical Center. She lives in Vermont with her husband and 2 children. Her son, Isaac, screened positive for glutaric acidemia type 1 through newborn screening. And since his diagnosis, she has become involved in newborn screening and rare disease advocacy on the state and national level. She was part of our consumer task force and is currently on Baby's First Test steering committee. She's also on the board of directors for the New England Regional Genetics Group, and in her free time, she enjoys gardening with her kids and growing a small flock of chickens. So welcome, Natasha and Allison, and thank you again for joining us and sharing your presentations. And we will start off with Natasha.
Great, thank you so much, and thank you everyone for joining us today. We have a lot to go over, but the past sessions have been really great with lots of good questions about how to engage people, what's the data out there, and how do we do more of that data collection. We know that so often in the projects we work on, people are really looking for ways to move from the anecdote or the story into more of quality data, but we believe that they both go back and forth and they're kind of the same, different sides of the same coin. So I'm going to be speaking today about our newborn screening family education program and really what went into um, us getting to a point where we felt comfortable being able to build out a module. And while some of you may say, couldn't you guys just do that in your sleep? We'll touch base on kind of why we took more of a methodological approach to this. So next slide, please. Great. The program that I'm speaking to you about is funded through a award from HRSA, and we are very grateful for that work and for that award. Next slide. We can perfect. So the vision of the newborn screening family education program is that all families have equitable access to newborn screening information and they have the confidence to participate in the newborn screening system. So we have this vision, which you may think these two things are a bit different, but we thought it was really important to call them out because it wasn't just about putting out an information or putting out education and hoping it was somewhere there in the ether, but really making sure we had a sense of, do families actually have access to that information? And then based off of that information and their experiences, do they feel that they are ready to participate in the newborn screening system in a range of different ways? Now, that doesn't mean they have to. It doesn't mean that we are forcing people to become newborn screening advocates, though, as we know, most people, once they find out what newborn screening is, they are very passionate about it and very always happy to share information. But we really wanted to make sure that our program covered both bases. This is a 5-year program. We just a couple of weeks ago started the 3rd year. But really the goal is that within 5 years that there would be a comprehensive newborn screening training program focused on families that provided them with the information they needed to be self-advocates, to find resources, and to serve as leaders in the newborn screening system. So I think you can see how the goals really match the vision. Again, we really wanted this to be not just about the information that's out there, but really what people can do with it, their behavior towards it, and what they can do to be self-propelling, if you will, in finding more information or sharing the information that they already know about with others in their community. Next slide, please. Great. So there are a number of program aims. I won't go through all of them, but the first one was really to do this assessment of newborn screening educational needs of families and partners. We really wanted to start this program off with a very solid foundation. Even though this is a space that we have worked in for many, many years, we really wanted at this point in time with this program to take the opportunity to see where are families currently at. Next slide, please. Great. So when we talked about the needs assessment within this program, these were the different components. So the program is really focused on families, so through the module and different things that I've already spoken about, as well as a partnership program, which is really focused on how do we work with our partners to get this information out, to raise awareness about the modules, and to hear from them what they think some of the needs may be. I'm really just focusing on the survey that is under the family section in this conversation today, but I wanted to show you that when we thought of the needs assessment, we thought of multiple different points of data collection and information that was going to be needed, and from different audiences, different stakeholders. Next slide, please. So I mentioned this at the beginning. Why do an assessment? This was a question that came up from many people, including our steering committee, who said, Natasha, baby's first test, you all know what parents need. You all know what is necessary. Isn't that what you do day in and day out? And while that is true, and we do feel that we have a good sense of the educational components that are needed, we really wanted to drill down to understand not just the content needs, but everything else that goes around an education program. And that's one thing that I'd want to share with everyone, is that it isn't just about a transfer of knowledge from one person to another. It really is how. And how are you going to have people be interested in that, to show up? What are the channels that they want to learn this information about? So we really have a framing in this program, as we do with all of our programs in Expecting Health, that it isn't just about what we want someone else to know about. It really is about meeting families where they are. And having that frame both helps us determine the strategies that we use, but also how we even ask some of the questions. Knowing the what does not, can you go back? Knowing the what does not necessarily mean you know the how. So yes, we know what is the information we wanted to share about newborn screening, the key components. We've done plenty of surveys and focus groups and other types of data gathering to really understand that what is important for families to know right off the bat. How do you have a tiered approach to the content that you share with families? But that doesn't necessarily mean we had done as much in-depth analysis of the how. How do people want to get information? And in some ways, the how is almost always changing in terms of how people get information from a day-to-day basis. The way people are interacting with different channels and different platforms today is different than it was 5 years ago, and is different than it was 10 years ago, and really looks different if you compare to 20 years ago. Probably a lot more change on that side of this equation than what newborn screening is, what families need to know on that point. So that was one reason why we really wanted to do this assessment. And even if there are small shifts in perspectives, those small shifts could lead to new educational opportunities. So it doesn't mean if we assess a family this year compared to 5 years ago and there isn't a big dramatic change in how people are perceiving newborn screening, that it's a loss. Even just little ways that people may use different terminology or may ask questions, or those little changes can provoke different ideas and more creativity on a project team side. So I know sometimes it can be difficult to find the time for the needs assessment or find the different types of support for those needs assessments. People really want us just to go and dive in and create a program and implement it, but it really always gives that opportunity for a bit of creativity and to see if there have been any shifts. And as we know, it's always important to be hearing from your primary audience directly. And in some of the slides, I'm going to talk about, well, what does it mean? Who is your primary audience? And how do you make sure that that is matching up with who is giving input throughout these different processes? Next slide, please. So the methods. So for our family survey, we had 2 different approaches. One was a web-based approach with a marketing research company. This part of our program, we worked very closely with RTI to do this work. The basis of this was you had to be 18 or older, either planning a pregnancy in the next year to 2 years, we're currently pregnant, or we're pregnant in the last 2 years. And it was also assessed if someone was living in a medically underserved area, which we'll be referring to as MUA moving forward. We also took this survey and disseminated it through disease advocacy and parent networks. So some of the networks that some of you may know that we're very familiar with. And part of the reason of doing that was we really wanted to see if there was a difference in between what we were calling invested communities and the general population. As you know, so often we may be doing an educational program that we are hoping reaches whoever is the typical parent or the typical family. And the biggest points of input through the project development come from people who are invested. Either they have a diagnosis, or their family has a diagnosis, or they're really invested in newborn screening for a particular reason. So we wanted to see, well, are there going to be differences? We are casting this big net, both using these two different approaches, one that's really, using a market research company, and the other really using our networks. And so it was important for us to see, well, are there differences that we need to be thinking about as we move forward and thinking about who do we hear from at what points in time, and how does that inform our final products? Next slide, please. Great. So this is a kind of large capture of all the different components that went into that needs assessment. And if you can recall back to the slide that had a bit of the flow chart, this is kind of that big needs assessment box at the top. We really will be focusing on the information that came from this brighter orange box, but these are just all the different points that came in. So again, reiterating that when thinking about needs assessments and surveying and all that, it can be pretty big. It doesn't have to be, you don't have to have all these different components, but there's a lot of value that can come from asking the same questions to many different people, as well as asking different questions to different groups of people. Next slide, please. So some of our key findings, we found that only 54% of the participants from the medically underserved areas were aware of newborn screening, as compared to 67% of those who were not from those areas. So right off the bat, that was an important distinction for us to see and for us to understand, that the starting point, if you will, of knowledge in these two groups were different. Now, I think many of us on the line would say it's still too low, no matter which group you're looking at, but this gave us an indication that yes, there was a difference, which some may have already hypothesized is going to be the case. That being said, families do have similar content preferences across different groups. So even though this first bullet, there's a difference, that doesn't mean the what people need is different. It may just be how much information, in what capacities, and are there just more competing topics that one group may be facing compared to another one. Majority wanted a 1 hour or less in length module, which was surprising to us. I was waiting for everyone to come back and say 15 minutes or less, but majority of people said 1 hour or less, and in that majority, it was split pretty 50-50 between 30 minutes or less and that 1 hour or less. Just about everyone wanted something that was online, whether it was a module, something to interact with, a video, or in person. Those were the highest ranked. So, and they were very close. I think I have a slide showing that data point. So that's one thing to keep in mind as we move forward, as we are looking at what is this data telling us. Next slide, please. So here is some examples of the data that we were finding, and this is split between those who are in medically underserved areas and those who are not in medically underserved areas. And you will see, when looking at what people think would be helpful in learning, it's pretty similar. It's actually very similar in terms of what these two groups are looking for. This was an important data piece for us to capture, because so often we hear, especially medically underserved, people living in medically underserved communities have very different needs. Their needs are different, but we want to say, oh, okay, well, what does that look like? In what spaces are they different? Is it the content? Is it the type? Is it the approach? And so this really was able to add to this broader story of, okay, what is needed, that it's actually pretty similar. People really like videos, people like informational images, and people really like stories. That's the truth across these two groups. So this is an example of where the story isn't necessarily what you're using needs to be different. Maybe there's something else that needs to be different in terms of approach. Next slide, please. what would be helpful in the module. So this was really looking at what people thought would be helpful within the program. And as I mentioned, we did a split of the data analysis between medically underserved as well as and those who are not medically underserved, but we also did a split between those who are affected by a newborn screening condition and not affected. And what affected means was not actually that person taking the survey had to have a newborn screening condition, but that they were involved in newborn screening, they had a family member that was affected by a newborn screening condition from a clinical standpoint, or just kind of in that invested community, as you said. Now here we saw a much more difference than we've seen in the other ways that we've split up the data. I thought it was really interesting that there were differences, particularly around the informational images and the interactive images in terms of what people thought would be helpful in the modules. Again, there's nothing here that is just strikingly something that's up at 90% for one group and at 20% for another group, but it does show that there's a bit more variation. And so when I think about, okay, asking this survey question and getting this data, what is the story here? Part of the story is, there may be some key differences or slight differences in the feedback that we get from someone who is in that invested part of the community and is really connected to newborn screening, and those who are not. And that's important to think about when so often when we are creating these educational materials and educational programs and strategies, who do we turn to? We turn to the people who we feel like are in the know, the people who are connected to newborn screening in a certain way. And then we use these materials and these approaches to reach out to those who are not as connected. And again, this isn't to say that that is a bad approach, not by any means. It's really just to show, there's a little bit of a difference, and there may be some opportunities to switch things up a little bit. Next slide, please. This is another area. We're going back to the split between medically underserved and not medically underserved in terms of where do you look for newborn screening information. For the kind of top 3 or so, in this, they're at the bottom of this chart, but the top 3 most popular are healthcare provider, family member, and friends. And those are very similar. So again, this example that for this split of the data, it's pretty similar in terms of where people are going for their trusted information. There's some that are a little bit more of a difference. Looking at online was a little bit different. Medically underserved in our surveys found we're a bit more likely to be using online sources for information compared to medically those who are not medically underserved. But again, it's not a drastic difference, which I think some people thought it might be, and might be a drastic difference in a different direction. Now, I will say this, it would be interesting to do this survey right now when we know so many families, since everyone is home and online much more, and many of the places that were more communal sources of Wi-Fi are not as accessible as they may be. Some of this data may be different today than it was when we collected it before the coronavirus. Next slide, please. So, next steps. One of the really interesting pieces is that we found that there truly is not a one-size-fits-all. Majority of the answers were split evenly. People like what they like. And that is kind of an important thing to think about, that it isn't ever about one approach. There was no one thing that was far and ahead better to do with one group of people compared to others. So that's something for us to think about in terms of providing multiple approaches to education and involvement in these different types of programs. As I said earlier, there may be more needs for those who are living in medically underserved areas, but that doesn't necessarily mean that those needs are drastically different. It may be more of an investment in something. So it may not be that there shouldn't be online modules, but maybe there need to be more of them, pushing that information out more, that there's less of a baseline knowledge base. You know, those are areas that we could definitely look more into for future research opportunities. We saw that the demographics were different depending on which networks we were asking. So as I mentioned earlier, we did one side of the project with a market research firm to really capture more of the general public, and then the other through the patient advocacy networks that we're connected to. The key places where the demographics were really different was between insurance, public and private. In the disease advocacy networks, much more on the private insurance side. In our market research, much more on the public insurance side. I'd say the biggest difference, and I don't have the number right off the top of my head, but was in terms of people who are participating in SNAP. I want to say that in the disease advocacy group network, that was about 11%, and then in the other one, it was closer to 27 or 28%. So some of those differences, same male, female, and also the differences in income. If we were categorizing under 70,000, there was much more variance in the salary, or I should say the income spread when we did the market research firm compared to when we were using our networks. And all of those are the reasons why we used a market research firm. We really wanted to capture more of that general population. And then those who were unaffected by newborn screening conditions gave equal weight to pregnancy-related topics. And this is really important as we think about our next steps. And again, not necessarily what are we educating on, but the how, is to really think about, well, if a group of people who are not very well informed about newborn screening, don't have a personal connection to it, really see it as potentially just as important as breastfeeding or getting prenatal care, we need to think about how do we frame newborn screening almost adjacent to those other topics they see as important, because that's something that they can relate to, as opposed to someone who may be, you know, newborn screening really changed their life, may say, you know, newborn screening is the #1 most important thing. Again, it's not about what's right or wrong. I think these are all good approaches. It's really using this type of assessment to figure out, okay, which approach is the best approach with these particular, whatever population you're working with. Next slide, please. I think that's it. Oh, sorry, I have 2 next steps. Next steps is we launched the module earlier this year. We're excited to share more of the data around who's been coming, who's been using it, some of our future ideas for that later this year. We also have been thinking a lot about, you know, developing a database of validated survey questions. We've done a lot of surveying of a lot of different people, and so often people ask, well, how should I write this question? How should we approach it? And thinking that that might be maybe a good service for others in this space. If you have any thoughts or ideas about that, please let me know. And also thinking about, well, when would be a good time to do a new needs assessment? What are the questions that we'd want to ask in that? And what would be the right approaches for that? I think that is it for me. Thank you very much. And I'm passing it on to Allison now.
Great. Thank you, Natasha. Next, we will have Allison present her study.
Great. Thank you. Thank you, Natasha. So as Jamie mentioned, my name is Allison Wood. I am a genetic counselor that works at Albany Medical Center, and I specialize in prenatal and cancer genetic counseling. But I am also a mom, and I have 2 children. My son, Isaac, was diagnosed through, after screening positive through newborn screening with glutaric acidemia type 1. And there he is, and there he is with his sister, Marianne. And so I thought to start off, what I would talk a little bit about is what led me to this project. So after Isaac was born, it took a couple years to kind of get used to having a completely different life than we were expecting. But what I really found is that I wanted to give back in some way, because it became clear very quickly that if parents before me hadn't fought to have GA1 added to the newborn screening panel, that our lives might have looked very different. And so one of the first ways I was able to become an advocate was through Baby's First Test Consumer Task Force. And through the Consumer Task Force, you learn about newborn screening, you learn a little bit about how to be an advocate, you're able to attend some conferences, and it was through those conferences and just listening to different people talk that I started to think about areas in newborn screening that maybe we didn't know that much about. And one of those areas was the first contact that families get about an abnormal newborn screening. One of the things that I had heard through other parents is that sometimes that initial contact didn't go as smoothly as parents would have hoped. But as Natasha had mentioned earlier, that was just anecdotal stories that I had heard. At one of the conferences that I was able to attend through the Consumer Task Force, I was able to talk to a doctor who mentioned that, we thought that we had a pretty good idea of what was happening when parents were being contacted about abnormal newborn screening results, but we didn't really know for sure what was being said or how that conversation was going with parents. And that's what really drove the study to happen. If you want to go to the next slide. And so today what I thought I'd talk about is the goals for this project, and then dive pretty deep into the methods, and I'll kind of go through the goods and bads of those, since I have a science background but had not done a lot of research before doing this project. There was a lot of things that I learned from doing this project, and then I'll talk just briefly about the results from the project, and then what came next after the project. So this was a project that I did with the Consumer Task Force, but then through my master's degree program in becoming a genetic counselor, I took this project to the next step and used the results to kind of drive what I hope will eventually lead to something to kind of address the needs that we found through this survey. Next slide. So the purpose of this project was to really look at that first contact that parents get about an out-of-range newborn screening result. So we wanted to see who is actually contacting parents. Is it the primary care physician? Is it someone at the primary care physician's office? Who is the general person that contacts them? What information is being given to parents? What types, ranging from, the basic of what condition it was all the way down to all the little details of what the next steps might be. And then really what parents felt that they needed more of during that call. Was there any additional information that they would have liked to have received during that initial contact? Next slide. All right, so kind of diving deep into the methods. To start with the design, it was a mixed method study. So there were qualitative and quantitative questions that we asked during the study. The quantitative questions that we asked were really centered around the information that people were getting, and then the satisfaction levels that parents felt that they had during that contact. So were they happy with the information that they received? Did they understand what the person was saying to them? Did they feel like the person contacting them was paying attention to the emotional needs that they had? Did they feel like the person had an understanding of the condition that they were describing to them? And so the way that we went about collecting this data was through a survey. But what we really needed to do first was figure out how we were going to get people to take this survey. And we did that by reaching out to advocacy organizations. And so what we did was we looked at the recommended universal screening panel. And for every condition that was on there, I went and Googled or went to NORD to find the advocacy organizations that represented those conditions. And we reached out to the advocacy organizations either via their website, through the email that they had on their website, or any other contact way that some people at Baby's First Test might have known a contact person at the organization. There were some goods and bads to that. So there were some organizations that I was never actually able to talk to a person, and so we had some pretty low response numbers from certain organizations where we just weren't able to get a hold of anyone. We did find out some organizations have varying degrees of availability to participate in research. So for example, the timing for the survey happened towards the end of the year, right around the holidays, and one organization had a group that would meet to determine if their organization could participate in a research project. But unfortunately, their meeting for the end of the year was canceled because of holidays, so that organization was unable to participate. On the other hand, there were some really great responses. So for example, I was able to talk with someone in the PKU community who then reached out to other people in the PKU community and other people within the PKU community who really spread the word far and wide. So we had a really great response rate from that organization or from that advocacy area. But it was really up and down from the different conditions represented on the newborn screening panel because of the ability to reach out to different organizations. Just in terms of timing, one of the things I wish that we had done a little bit differently is we collected data from November 1st, 2018 through January 31st of 2019, which at the time to me seemed like a very, very long time. But looking back on it now, it's really not that long in terms of data collection. So while we did have 283 people that were able to respond, I think that if we had been able to extend that a little bit, we could have gotten more responses. The survey was also distributed through Baby's First Test and through Genetic Alliance through their social media platforms. And we included parents or guardians who had a child who screamed abnormal between January 1st, 2014 and January 31st, 2019. And the reason we did that was to increase the recallability. We felt that parents that had children before them might not be able to really recall what had happened during that initial contact. So the survey was designed through SurveyMonkey, and it was only 13 questions long, so it was very short. So 11 questions were quantitative, and then we had the 2 qualitative open-ended questions. And those 2, I think, really bring the survey together and show the storytelling that parents can have in a survey like this. And just, we left it very open as what would you like to see being done differently? And with 283 people taking the survey, we had a lot of responses that were really impactful. The survey was divided into 3 sections, with the first section being the demographic data. The next section went into the satisfaction levels and the type of provider that was contacting the family. So those were more quantitative questions. And then the last 2 were those 2 qualitative open-ended questions. And Genetic Alliance IRB approved the study. So the data analysis, for the quantitative questions, the analysis was done using SurveyMonkey. For qualitative analysis, what we did is look at each of the responses and use open-ended encoding to see what the themes were of each response, and then generate themes from those responses. Next slide, please. So I've done similar presentations talking really deeply about the results of this study. For the purposes of this talk, I really wanted to focus on the qualitative responses to the survey, because I really feel like what people have to say about their experience with that first contact of an abnormal newborn screening can really drive what people are feeling. There was kind of a plethora of responses, from people feeling really happy with the way their first contact went to people feeling very unhappy and wishing that things had gone differently. So I'll start out with, the question was there any information you wish you had been given during the initial contact that you did not receive? And so in terms of some people just said, no, we were happy with what we got, or they had positive responses. One person said, our doctor was extremely sensitive and supportive. In hard times like that, it is impossible to have all the questions answered right away. Our doctors did the best they could with the limited knowledge they had. So that was a really positive response. And it was clear from doing the survey that when the person contacting the family was tried to be sensitive and emotionally supportive, that the satisfaction levels were higher, which makes a lot of sense. Next slide. So there was a theme that sometimes the initial contact lacked needed relevant information for the families. And that could further be broken down into families saying that they wish that they had been given accurate websites or resources, or that they wish that they had been told that there was treatment available for the conditions, or that they wish they had been told that there were support groups, or that they wish they knew who they could contact with questions. So one person said, I would have liked an informed explanation. Our doctor knew nothing about the condition and just said we needed to go to a metabolic and genetics hospital out of town and they could answer our question. That led to a lot of online research and no sleep for my husband and I for 3 days, worry unimaginable and broken hearts. He is a perfectly healthy boy, thriving greatly. Next slide. So when you broke down some responses from participants about accurate websites, one person said that they wish that there was an improved website with more information about the condition instead of having to do their own research, frantic research as they were being rushed to the hospital. Another person just said more information in general, being terrified and left to Google, which is even scarier. Another person said, I would have liked more information about a good PKU resource. We just went straight to Google, which wasn't a good thing. I understood that they want people to hear information directly from the doctor, but some type of resource would have been helpful. And I think the main themes that I saw was that there's this block of time from when you're contacted initially about an abnormal newborn screening result until you get some follow-up information. And I think from a doctor's perspective, that amount of time is not that long in the big scheme of things. But for a parent that has just received this possibly very devastating news, a day, 2 days, 3 days, 4 days is a lifetime to them. And so that initial contact really sets the tone for the next few days while they're waiting for follow-up information. And it's really important during that time that families are given the information that they need to get them through until they're able to hit those next steps. Next slide. The next theme was the availability of treatment. I think that as a newborn screening community, we now know what newborn screening does and why it's so important, and that if someone screams abnormal, we're able to hopefully get people on treatments as soon as possible. But for parents, many times they might not know that there's treatments available for these conditions. And so to get this kind of information and not know that there's treatments available and then have several days pass without knowing that can be really, can have a really big effect. So one person said, once the specialty clinic explained that treated PKU wouldn't have the symptoms we read about, we felt so much better. I wish that was the first information we received. Another person said, I wish he had told me that it was controlled strictly by diet and that my child would be fine as long as she was on it. That would have been less terrifying than the unknown diagnosis. Another person said, we were given very vague information that led us to Google the condition and stress about the extreme long-term effects, then had a very terrible first appointment. It would have been nice to have someone explain that in the event it's not a false positive, our child would be okay with diet management. Next slide. People mentioned support groups or who to contact with questions. So one person said, I wish I'd been connected to a support group, someone who'd been through this before. Another parent, it almost threw me into a depression because I didn't know what it would mean and it took me a long time to accept it and not be bothered by it. Another person said a contact number that I could actually contact someone. We just got a hospital number and they were never in their office to return phone calls. And then another person said a way to contact others living with the disorder. We felt so alone and found the support group by chance. Next slide. Okay, another major theme that we saw was that parents sometimes felt like there was a lack of knowledge by the person contacting them. One person said, the initial contact I had was a phone call from a nurse at the pediatrician's office. She told me my daughter was positive for PKU, but she was positive from MCAD. She could give me no information aside from scheduling with the pediatrician that afternoon and to take my daughter to the ER if I became concerned for her. She wasn't very compassionate and had zero information to provide to us aside from the fact that there were abnormalities seen. Next slide. And so here's some more responses in terms of people feeling like there was a lack of knowledge. I wish the pediatrician told me the contact information for the specialist or had a better understanding of the condition. The initial visit when the pediatrician explained that my child could possibly have BLCAD was confusing and very different from the explanation I received later. Having a child is emotionally and physically draining and the information was not presented in a clear and understanding way. Another person said, yes, the nurse who called me told me that the condition could be mental retardation, which has nothing to do with the condition. And another person said what the condition actually was. We were home 2 hours and got the call from the pediatrician. Some information would have been nice if they knew what he was being tested for. Kind of frightening that we had to go to the ER of the children's hospital with our newborn to be stabbed with IVs with absolutely no information from the pediatrician. Next slide. And then the final theme that we saw was that sometimes people felt that there was a lack of empathy by the person making the call. One person said, yes, I wish the person contacting had been understanding of the severity of the news I was being given, had given some information about what was happening and what his possible outcomes were. Next slide. Another person said, I do not know, the woman was extremely rude and made me think I was doing damage to my daughter. Another person said, I wish I had been contacted by a pediatrician with a more humane way of saying things, explaining this to us more clearly, and not basically someone reading out of a pamphlet with no emotion whatsoever. And then finally someone said, yes, any or all of it, any information would have been helpful. An office administrator calling out of the blue to schedule an appointment for an out-of-town blood draw on my newborn was horrifying enough, but the fact that she couldn't answer any of my questions and was incredibly nonchalant about the whole thing made me sick. In my opinion, this person was not qualified to make the phone call. At the very least, this phone call should have come with resources and straight from the pediatrician himself, not from a random calendar pusher. Next slide. Okay, so in response to all of that information, it seemed like parents had specific things that seemed to be themes kind of across the board of what types of information they were looking for. And so in order to take this information and turn it into something useful for families, what I did for my capstone project in my genetic counseling program was designed a video that kind of addressed all the needs that were brought up by parents. And this video is designed to be sent out to families who have just received contact about an abnormal newborn screening. It's very hard because of every state contacts families in a different way. And so there's different levels of timing that needs to happen. Some results need to be given right away, which might impact the type of person that's calling families as well. So instead of trying to get around the fact and get to the people making these calls, what we thought would be important is to design some sort of video that would talk about what information parents should know after the contact. That way, if they haven't been given that information, they can advocate for themselves to get the information that they need. It also provides families with resources that have good information, websites where people can go to for accurate information so that they don't have to Google and end up in a place that maybe is not a great place to be. And it also talks about why we do newborn screening and why newborn screening is important. So this video was designed for New York State. My capstone project was done in New York State with the New York State Newborn Screening Department. Unfortunately, about a week after we started our project, coronavirus hit, and all of the projects being done through there were canceled. So we don't have any results from this project, and I'm really hoping that as things calm down, this is something that can be taken further. I will preface playing this video by saying that I am not a video designer. I have no experience in video designing. This is the first video that I've ever designed, and I had no budget to make this video. So this is version number 1, and hopefully as time goes on, there'll be better, more exciting versions. So you can go ahead and play the video.
Receiving contact of an abnormal newborn screening can be overwhelming and scary. This video will give you the information you need to help you better understand the newborn screening process. Newborn screening is a public health initiative that screens all babies for certain serious health conditions. Every year, New York State screens about 230,000 babies for 50 serious conditions through newborn screening. The goal of newborn screening is to identify babies at risk for certain serious health conditions and get them on treatment as quickly as possible. Newborn screening lets us know which babies are at risk for certain serious health conditions. This group of babies then undergoes further diagnostic testing to determine if they have the condition or not. If your child has received an abnormal newborn screening, follow-up testing may be necessary. Your doctor will know better what testing is appropriate. Newborn screening consists of 3 parts. The first is a hearing test. The second is a pulse oximetry test to test the level of oxygen in baby's blood. And the third is a heel prick to screen for certain serious health conditions. Newborn screening does not screen for every condition, and because of this, if you notice any symptoms that you are concerned about in your baby, you should contact your doctor immediately. If a newborn has an abnormal newborn screen, the family will be contacted to set up additional testing. This further testing will determine if the baby does or does not have the condition they screened positive for. Receiving contact of an abnormal newborn screening can be overwhelming and scary. Here are a few questions you should know the answer to and a few tips to help you get through this time. First question you should know the answer to is where, when, and with whom is the next appointment. The next question you should know the answer to is what testing is being considered or is being done. Your doctor will be able to answer this question. Next, you should know if there are any specific symptoms you should be watching for while waiting for confirmatory testing. Be sure to ask for specific details on what symptoms to look for and when to bring your baby in if you see them. Finally, you should know who you can contact if you have any additional questions or concerns. The internet is a powerful tool, but there is also a lot of misinformation on the internet. Here are some great websites that talk about different aspects of newborn screening. The New York newborn screening website has state-specific information for families. Baby's First Test has information on specific conditions and the newborn screening process. And the Genetics Home Reference has condition-specific information as well as guided information about genetics. Let's recap. The goal of newborn screening is to help identify newborns that are at risk for certain serious health conditions so that treatment can be started as quickly as possible. Newborn screening cannot tell you for sure if your baby has a condition or not, so it is important to keep in contact with your baby's doctor about what your next steps are. Thanks for watching. Please help us make this video better by clicking on the link below to be taken to a short survey.
You can stop it here. Okay, so I think that's everything that I wanted to touch on. I'm really hoping that this video can kind of go through more versions.
Receiving contact of an
and be something that could be implemented in other states. So yeah, I think that's it. And oh yes, thank you very much for all of the organizations that helped by participating in this study.
Great, thank you, Allison. The video was wonderful. And I know that we have about 3 minutes left for our time today. And we did have a couple questions go through. Someone asked, can the video be edited for other states?
Yes, and I mean, my goal is my personal deep goal is that this is something that could be utilized by hopefully every state one day, and just kind of sent along with the information that parents get so that they're able to know what the information. The problem is you don't know what you don't know, and when you're thrown into a world where you have no idea what you should know, you don't know what questions to ask. And I'm hoping that this video can help just give parents like a foundation of what they should know after that initial contact so that they can advocate for themselves and the information that they need. So yes, it could be edited.
Great, thank you. And then we have one more question, and this is for both of you. It sounds like you guys are both developing newborn screening education materials for families. And what advice do you have for others who are interested in developing these materials?
Can you repeat that one more time? I'm sorry.
Yeah. So you guys are both kind of developing newborn screening education materials for parents and for families to really raise awareness. What advice do you have for other programs who are interested in developing these materials?
I don't know if my advice is like perfect advice, but my advice is that if you're passionate about it and you want to do it, to just take the first step and start doing it. I really had no idea what I was doing when I went into this, and I was able to, work with Babies First Tests and other people that do know what they're doing, who could kind of help guide me through the parts that I didn't know. So I guess my biggest advice would be, if you feel really passionate about something and you think that there's changes to be made, to just take the first step and start doing it, and the details will kind of fall into place as you're going along.
Yeah, my advice is actually really similar. I think that's the case if you are an individual working on these items or a whole organization. It really is just to take that first step. And I would say in that, just to identify what is always have a big vision if you can, and kind of what the big goal is, but then think what's a step that you can take in that direction. And then think of all the different times you can really iterate on that. And I think asking for feedback is a great way to do that. Just to say, exactly how Allison just did, said, here's this video and this is where it's at now. What are your ideas? What are your thoughts? I think it's important for people to realize that they are not alone, and that there is a lot of energy in newborn screening education and people really wanting to do it, and to reach out to people who are doing the work, just to ask questions. It's a friendly bunch. And so just reaching out and seeing what others can help you with, whether that's content, because there is a lot out there. And I think that just means that there's a lot of different ideas out there that you can pull from, and that can help you with your creativity.
Great. Thank you so much. I know that we are at the hour. So again, thank you, Natasha and Allison, for sharing your projects and presenting all the wonderful work that you all are doing. And thank you all for joining us. This is our last engagement in education session, but we hope to be hosting more of these sessions